People of faith must never treat someone's as some things.
Yes, Tony, but there are exceptions.
The American Religious Town Hall meeting is now in session.
Welcome, friends, to the American Religious Town Hall meeting, where the discussion of religious, political, and social issues is meant to promote the cause of religious freedom and to help us better understand each other. And now, here's your host and moderator, Pastor Jerry Lutz.
Thank you for joining us today. We're so glad that you've tuned in to today's program. It's going to be an interesting discussion, as I think they always are. But before we get started today, let's have our panelists tell us who they are and a little bit about what they do. Let's begin with the gentleman to my right.
My name is Mel Robeck. I'm Senior Professor of Church History and Ecumenics and Special Assistant to the President for Ecumenical Relations at Fuller Theological Seminary in Pasadena, California. I'm also a minister of the Assemblies of God.
Hi, I'm Tony Matthews, and I'm the Senior Pastor at North Garland Baptist Fellowship in Garland, Texas.
I'm Dan Levin. I'm the Senior Rabbi at Temple Bethel in Boca Raton, Florida.
My name is Canon John Peterson. I'm an Episcopal priest, and I'm canonically resident in the Diocese of Washington.
Hi, I'm Carl Troval. I'm the Richard J. Dinda Professor of Lutheran Identity and Mission at Concordia University in Austin, Texas.
I'm Tom Plumley. I'm a minister in the Christian Church, Disciples of Christ. I serve as senior minister at First Christian Church, Fort Worth, Texas.
Well, thank you, everyone, for being here today. I'm looking forward to hearing what you have to say. We've already heard so far from two of the panelists. They'll have more to say. But before we get started into our discussion, let's talk about defensive humanization, dehumanization. What is that? Well, defensive dehumanization is a process by which people ratchet down their emotional involvement in the suffering of others. Studies of the behavior usually concentrate on people working in the healthcare field, but it can also be seen in first responders, counselors, clergy, and other helping professions. Doctors and nurses, for instance, can sometimes seem detached, callous, and even uncaring simply because they see so much hurt and distress and cannot do their jobs if they were to become as emotionally involved as their patients or their patients' friends and family. They're required to learn to objectify their patients to at least some degree to avoid burnout. Our discussion today is around the question of how or whether this defensive dehumanization might be evident on a larger societal scale. A logical extension of the findings of studies on defensive dehumanization in medicine and other fields might conclude that defensive dehumanization is at the core of some of our deeper spiritual problems and even our political stagnation. All of our faith communities teach love and concern for those in need. But do we sometimes not help as much as we might simply because we are aware of so much need among so many hurting people? A case could be made that we objectify people or groups and dismiss or ignore them, not out of lack of compassion, but because of information overload. A few questions I'd like for our panelists to consider, first of all, today. The first question would be, can people of faith expect themselves to be always compassionate, always caring? What do we do with the guilt when we can't do all the helping and loving we want and feel called to do so? Might this phenomenon of defensive dehumanization at least partly explain the social divisiveness and exaggerated bitterness we so often fret about? That is our program subject for today, and those are the questions that I'm asking our panelists to consider. Let's go back to those who helped to start the program with opening remarks, and for that we go back to Dr. Tony Matthews. Glad to have you here today.
It's good to be here.
Tell us some more of your thoughts on this.
Yeah, I think this is a very fascinating topic. It's very relevant, and I'll speak to it from a pastoral perspective. We certainly should never, as a cliffhanger said, treat people as things. And I certainly understand that in ministry, because we are called as pastors and clergy and ministers to love and to have compassion and to weep with those who weep, to rejoice with those who rejoice, we are connected to our parishioners and to our people that we shepherd. And I do think, though, that our greatest strength, which many times is compassion and love, can become our greatest weakness. And I think we have to recognize that we are humans, and we're not really made to carry all of that load and the weight day in and day out. I remember specifically one day, maybe less than a few years ago, when I got a phone call from one of our members, and this member was obviously in distress, and it was apparent that he was going to try to take his life. And I was en route to his home, and en route to his home, I got a phone call from another members stating that one of our members just died, a very good friend of ours. And when I got to the home of the person who called me initially, I discovered that he took his life. So I had two great friends within an hour who died. I had to minister to the families, and it was no way for me possibly not to take that home. I took that home with me, but at the same time, because I've pastored for a while, I knew that I had to delegate, and I had to implement some self-care, because, and those are just two instances, and they are extreme and tragic, but when you compile that with all of the other duties that clergy people have, and then the health professionals as well. There's a great article I read, Vicarious Trauma and the Therapeutic Relationship, and they talk about how we have to practice self-care. And I think we have to get back to loving people, having compassion, but at the same time knowing that we have to take care of ourselves. And that would prevent us from treating people like things and minister to them effectively.
Thank you. Now, Canon Peterson, you also made an opening comment. More thoughts on that, please.
Yes. I appreciate what Tony has said, and I'm basically in total agreement with him. And there's one exception. I think that empathy is not in the ball game. And that is particularly, and that's my one exception. And that is when someone's in surgery. The surgeon at that moment cannot have empathy. He or she has to do the surgery. And that is certainly at one moment, at least in time, in which empathy is not a critical criteria for patient care. Because the patient care is to make sure that the person is operated on and all the surgical procedures go absolutely to the book. Otherwise, I thought, in agreement with you. And I perhaps am going to be far more idealistic than I should have been, or should be. And I perhaps, when my wife hears this program, she perhaps will let me know that as well. But last week, I had our next door neighbor in the community in which we live was hospitalized. Her blood pressure was absolutely, totally off the map. Sweating, they had to carry her out of the house and put her in the ambulance and everything. And she went to the hospital, and the doctors did their treatment, and the blood pressure doctor came in. And, she was worried. 91 years old, and you are 200 plus blood pressure, anyone would be worried. And she asked the doctor, what was going on. And the doctor did not say one word to her and walked out of the room. Well, you can imagine what that did to her blood pressure.
Yeah.
Total non-empathy.
Right.
And so easy, it is so easy for doctors, health caregivers, clergy, to be that doctor walking out of the room.
All right, thank you very much. Dr. Trovall, welcome back to the program.
Nice to be
Your
back.
thought on the subject, please, or thoughts, I should say, on the subject.
I commend to any of you who are listeners of podcasts, there's an episode of The Hidden Brain called The Empathy Gym. It's July 27th, is 2019. And in it, they interview an author, Jamil Zaki, who wrote The War for Kindness, Building Empathy in a fractured world. And I tell you, it responds to all of these questions and goes beyond. He talks about empathy being three parts. Cognitive, there's a cognitive empathy with people, and then there's an emotional empathy, and the third piece is there's emphatic concern, that is a desiring to improve the situation, and that all three components are necessary in this moral deliberation. And he does talk about defensive dehumanization, although he would say what it really is about is it tends to be people who are deeply empathic who practice this for precisely the reasons of the overload. He said it's like you see the homeless person, and the person's just like, oh man, I feel so sorry for that person, but I really don't want to have to look them eye to eye, right? And so you avoid them. So that it isn't people who are calloused who are practice this, but people who are deeply empathic. And he does spend some time in this podcast talking about empathy being a muscle that can be strengthened or it can get weaker. And he talks about a number of ways you can do it. One is through novel reading, because he says that empathy is understanding someone else's world and experiences that is just as real as your own. That's his definition. And I found that to be really helpful because I realized that a lot of this is self-awareness. Jesus pulled away because he was so burdened by the needs of the people. So you have even Jesus as an example who pulls away to restore himself, to come back and serve. So I think this is really important to have a self-awareness and then to use it in a wise way to serve people.
All right, thank you, Reverend Plumley, and then Rabbi Levin. Reverend Plumley.
Thank you. I want to take this to the societal level because I think we do this all the time at the societal level as well, and we don't recognize it in the same way that we recognize individuals who have to do this. A prime example is in war. We cannot send men and women out to kill other men and women who are aware that the person on the other end of that bullet is a father, or is somebody's daughter, or is a human being. There's a part of the beginning, the run up to every war, is an effort to. It's a part of the word that gets put out into the larger community, that somehow those folks over there have become, some way, a little less human than we are, okay? That's one of the ways that we sell war. I think in this culture in which we literally are drinking information from a fire hose, okay? We have so much coming at us that it knocks us over, okay? We tend to have to dehumanize folks, large groups of folks sometimes, simply because of information overload. And I think that's a very real thing. We see on the news, night after night, we start saying, gee, every night the Muslims have bombed somebody, or every night the Democrats are trying to spend more money, or every night the Republicans are taking away somebody's rights, or every night ghetto kids are killing each other. And very soon that becomes all those people are doing that. And then it's just a simple move to being less capable of seeing that person as an individual and more willing to discount them as people.
All right, thank you, Rabbi Levin.
So I think that this conversation is interesting because I think that when we surrender our empathy, we surrender our humanity. And there's been so much written about what happens when we feel that sense of disconnect from somebody else. Johann Hari recently wrote a very interesting book about how disconnection is really the source of depression that we see in our society. Rachel Naomi Remen, herself a physician, wrote years ago about how the more a physician cares, the better care that physician is able to render. However, at the same time, I think that there is this phenomenon that we all have to experience called compartmentalization. So for those of us who work in congregational work, each of us can probably tell a story of when we had to, as you did, deal with a tragic loss, or in your case, compounded tragic loss, in which you, in order to conduct a funeral service for a young person, you have to set your feelings and sort of compartmentalize them so that you can lead that ritual and only then later collapse in your office. But if you let go of that empathy, you're in trouble. I'm reminded of, in the book of Numbers, when God orders that a census be taken of the Israelites, that God asks Moses and Aaron not just to get the number, but each and every individual's name. Now, what Moses really needs to know is how big an army can he muster, right? But what was more important to God is not how big an army could he muster, but who were each and every individual in that army. I think the power of the Vietnam Memorial in Washington, D.C. is not the size of the granite, but it's each and every individual name.
All right, thank you very much, and very well said. We're empathetic to what you've just said, too. Most of us around this table, for sure. And then, Dr. Robeck, your comments, please.
Yeah, I think, in a sense, we're talking once again about burnout, because all of us are prone to that. Those of us who are in helping professions, our doors, our offices, our homes are open 24/7, and we never know when things are going to happen, or who's going to call, or who's going to knock on the door, or whatever. And I think that what Scripture has tried to do is to help us to understand that we need to live balanced lives. God worked 6 days, and He rested on the seventh. And we tend to refuse to follow that line on the whole, certainly as a society. It's very difficult for us to think about that. But I do think that we're called to be good stewards of our personal resources, and that includes our ability to face day to day all the kinds of problems that we must face. And I think it's easy for us to dehumanize other people, but I also think that it's something that produces enormous amount of guilt when we do it. And we have to deal with that as well. So, when I think about it on the larger societal issue, I totally agree with you on the war and how we get people ready for war. We demonize the other side. But the fact of the matter is, even when we are trying to do something positive, an earthquake strikes in Indonesia, everybody has to be kind of brought together. Let's all send a lot of money and aid and so forth to Indonesia. 4 days later, another earthquake takes place in Bolivia, or whatever. And we get tired. We get tired. And as a result, we don't think about these human beings who are going through all this kind of suffering all the time. So I think we really have to be ready with personal planning, with budgeting our time, with good discipline, and most of all, being the stewards of what God has given to us, both time and resources.
It's easy to get used to anything when you do it many times over and over again, and thinking about paramedics and first responders. But when we lose our humanity in that process is when I think we need to come back and ask ourselves some questions. Have I become too used to it? And just a couple of responses then, Reverend Plumley, and then over to Carl.
Yes, I think we need to learn how to spot that in ourselves, okay? Because we're not going to change that. We're not going to carry that empathy on into the 14th circumstance in which I encountered this tragedy. And we need to learn how to spot it in other people and perhaps not be so angry with them because we realize that they're just overloaded.
Dr. Trovo.
On the group level,
Briefly.
Very briefly. You mentioned warfare, but it also in police departments. They find there's empathy for police for citizens, but when it comes to empathy for their own police officers, there tends to be a greater empathy. So sometimes empathy can be actually pitted against one another, and people struggle with what loyalty they should have.
10 seconds, Ken Peterson.
Well, I would also respect for the other person. And here we go to the golden rule, and I'll say something about that in my final summary.
All right. Well, thank you very much. Great discussion so far. There are summary statements yet to be made. We'll be back in just a few moments after this important message.
Thank you, Pastor Lutz. We hope you are enjoying today's program. If you would like to learn more about the American Religious Town Hall, please visit our website at americanreligious.org. That's AmericanReligious.org. There you can read about the mission and history of the program, learn about the Town Hall Estates, and view past programs by clicking the appropriate menu buttons. Each week, Pastor Lutz looks forward to receiving your letters. You may write to him at the address shown on your screen. Send your letters to Pastor Jerry Lutz, American Religious Town Hall Meeting, P.O. Box 180118, Dallas, Texas 75218. That's Pastor Jerry Lutz, American Religious Town Hall Meeting, P.O. Box 180118, Dallas, Texas 75218. Thank you for writing, and thank you for watching. And now, back to you, Pastor Lutz, and today's closing statements.
Welcome back. I am very glad that you've decided to join us for today's program, and we're looking forward to the summations. But before we go there, I too would like to encourage you to go to the website where you can learn about the Town Hall Estates. Speaking of empathy, you'll find there that these caregiving facilities offer not just empathy, but sympathy as well. They totally understand the conditions of those who are clients, and I would encourage you to learn more about that. So let's go to the summations just now. Let's begin with Dr. Robeck. You're first.
Yeah, I've noted on previous programs that that I walk to work, which is a 2-mile walk through the middle of town, and I often, almost every day, meet up with homeless people. Almost always they will approach me and ask for something, and I take the time to sit down with them, and I won't give them money, but I will take them to a coffee shop or restaurant or whatever. I'll buy them whatever we need. But that's not the point. I mean, the point is, I think it's really important for us to balance what we're trying to do. To speak to these people as individuals, I can only do that so many times in a month, and I have to take a break. So I think even as Jesus, and I appreciated your call about Jesus withdrawing from everybody, but you know, he got on the boat and he went across the lake, and he had more people there.
Right,
you know,
right.
The only reason he could do that was because he cared for himself. He took the time to care for himself, and I think all of us are in need of doing that.
All right, thank you very much. Rabbi Levin, your summation.
So I think it's normal to feel calloused sometimes by the hurt and the pain and the suffering that we see in the world and our own interactions with it. I know there are times where I start to sometimes feel a little numb. And it's those moments that I feel like it's everyone's responsibility to seek out a bit of spiritual tenderizer and to soften ourselves up again. For me, sometimes that's watching a movie that's a tearjerker, because if I can't cry at real life, then I can force myself to cry in the dark. And I think that the more that we can do to try to soften those calluses, the better we're going to be as partners in the stewardship of humanity.
Thank you. Well said. Now, Dr. Troval, your summation, please.
Yeah, George Bernard Shaw said that inside of every human being, he found every person infinitely interesting. He said, you just have to keep asking questions. And I think that trying to connect to the reality of other people, we've talked about the struggles with it, but I don't want to forget the benefits of it. People who tend to be empathic tend to be, overall, according to studies, happier, more contented people. Yep. It reduces stress. It tend to be well-adjusted. I mean, you can talk about all the positive benefits of empathy, too. So in light of the cautions and the helps and the suggestions for increasing our empathic ability, I mean, it's well worth it to be an empathic person. It's worth the cost.
Thank you. Thank you. Let's go to Reverend Plumley. Your summation now, please.
Thank you. Religious diversity, racial diversity, all these different opinions that people have, and we're hit in the face with them through all the different forms of information sharing. All of that is growing in our society, and yet we have a rather empathic culture in which we live. But yet these things tend to make us uncomfortable. They call us to be more tolerant, sometimes in ways and places that we don't even want to be tolerant. These realities call for us to really work at self-care and at also to fight the tendency toward demonizing anyone else.
Thank you. Now, Canon Peterson, your summation, please.
Yes, I'd like to repeat what I said at the very end. The opposite of dehumanization, of course, is empathy and respect. And two words are very important in that whole understanding of dehumanization as the opposite. In the three great monotheistic religions, Judaism, Christianity, and Islam, one of the basic cores is the Golden Rule. And the Golden Rule is as humanizing as it gets. Do unto others as you want them to do unto you, unto me. And here there should be no us, them thinking, but do unto others as you would like to have them do unto you.
Thank you. Good reminder. And then also, Dr. Matthews, your summation.
We've heard it said around the panel that the best way to care for others is to care for yourself. One of my favorite Old Testament passages is when Moses was caring for the people out of his compassion. He loved the people. He was up day and night ministering to them. He had empathy, he had sympathy, he had compassion. But his father-in-law saw that what he was doing wasn't good. And there's a passage in that context that says, hey, you're going to wear yourself out, but not just yourself, you're going to also wear the people out, because he would not have time to minister effectively to the people. So I think we have to kind of look at delegation, sharing the duties with other people, and that gives them an opportunity to take on the load and to become caregivers themselves, coming alongside you in a partnership.
All right, thank you very much. And thank you to each one of you for today's participation. I've certainly enjoyed this discussion. I hope you have too. And if you're interested in these kinds of subjects, go to the website. You can find archive programs there where this panel discusses a variety of subjects. And I'm sure you're going to find one or two or maybe many of them that you'll really appreciate. But I hope this has been a learning experience for you today, even as it has been for me. And we do look forward to getting back together again next time. But until then, the Charter of the American Religious Town Hall provides that Roman Catholics, Protestants, Jews, educators, and others may appear on this program and can declare their beliefs without hesitancy. And the rest of the members of the panel will uphold and guarantee that American right to all who will appear, irrespective of race or creed, so that the rest of the world can see that here in America we believe in civil and religious freedom, and not only in theory, but in reality. So now, friends, until next week at the same time and over this very same channel, the American Religious Town Hall meeting stands adjourned. And may the God of all of us bless all of you.